In today's class, we are going to discuss about the femoral triangle, the femoral shield, and the femoral canal. First, let us start our discussion with the femoral triangle. Okay? So see, femoral triangle here, femoral triangle. The femoral triangle is a triangular depression on the front of the thigh located in its upper one-third immediately below the inguinal ligament. So what is the femoral triangle? Femoral triangle is a triangular depression located at the upper one-third of the front of the thigh immediately below the inguinal ligament. Now let us see the femoral triangle, its boundaries, contents, and also we shall discuss about what are the structures which are forming the roof as well as the floor of the triangle. So here let us draw anterior superior iliac spine, and from the anterior superior iliac spine the structure which passes downwards towards medially is called as the inguinal ligament, and this is the pubic tubercle. So inguinal ligament extends from anterior superior iliac spine to the pubic tubercle. Okay. Now I will draw an important muscle which is the longest muscle present in our body called as sartorius. This is the sartorius, and another muscle I will draw from the pubic tubercle. This is called as the adductor longus. So this is the adductor longus. Adductor longus. So by this the femoral triangle is formed with three boundaries. Superiorly it is formed by inguinal. Superiorly it is formed by inguinal ligament, and laterally the triangle is bounded by the medial margin of the sartorius. Superiorly it is bounded by the inguinal ligament. Laterally it is bounded by the medial margin of the sartorius. Medially it is bounded by the medial margin of adductor longus. You know, this is the medial margin of adductor longus, and this is the lateral margin of adductor longus. So the femoral triangle is formed by three boundaries. Superiorly it is formed by the inguinal ligament. Laterally it is formed by, or laterally it is bounded by the medial margin of the sartorius, and medially it is bounded by the medial margin of the adductor longus. So now, after we studied the boundaries of the femoral triangle, now let us see the floor as well as the roof of the femoral triangle. So first we shall discuss about the floor of the triangle. After the floor, I am going to discuss about the structures which are forming the roof of the femoral triangle. So here if you see the triangle, the structures which are forming floor of the femoral triangle are totally 4 muscles. 2 muscles are on the medial side of the floor of the triangle, and 2 muscles are on the lateral side of the floor of the triangle. So here what I will do means, Here I will divide a line. Here I will divide a line. This line actually divides the femoral triangle into the medial aspect as well as the lateral aspect, right? Now medially, if you see, the femoral triangle is formed by, or the floor of the femoral triangle is formed by the adductor longus muscle itself, as well as another important muscle you can see here. Another important muscle you can see here. This is called as pectineus. So medially, the floor is formed by two muscles. One is the adductor longus and another one is the pectineus. Is called as pectineus. And if you see laterally, laterally also the triangle contains two muscles which forms the floor. One is called as the iliacus and another one is the psoas major. In the psoas major we cannot see the muscle of the psoas major, but we can see the tendon of the psoas major here. Okay. So here I will draw the tendon of the psoas major first. So here you can see the psoas major, that is the tendon of the psoas major. Psoas major. After the psoas major, more laterally, the floor of the triangle is formed by the iliacus muscle. So more laterally I will draw, the muscle is called as iliacus. So more laterally, here you can see it is formed by the iliacus. So by this you came to know what are the structures which are forming the floor of the femoral triangle. The floor of the femoral triangle formed by four muscles. Two muscles are on the medial side and two muscles are on the lateral side. The muscles which are forming the floor on the medial side of the triangle are adductor longus and pectineus, and on the lateral side pectineus, on the lateral side you have the iliacus as well as psoas major. So after studying what are the structures which are forming the floor of the triangle, now we shall discuss about the structures which are forming the roof of the triangle. Okay. So here I will give the heading. Now here we are going to see what are the structures which are forming the roof of the femoral triangle. So here the roof is formed by the first one, skin. The roof is formed by skin. After the skin you have superficial fascia, skin, superficial fascia, and on the superficial fascia we have the cutaneous nerves, cutaneous arteries as well as lymphatics. So here I will mention lymph nodes. On the superficial fascia we have the cutaneous lymphatics as well as lymph nodes. We have cutaneous arteries, cutaneous veins. Mainly we have the great saphenous vein runs along the superficial fascia. From the superficial fascia it pierces the deep fascia at the saphenous opening and drains into the femoral vein. So not only in the cutaneous vein, the important vein is great saphenous vein, or we can say the upper part of the great saphenous vein, which is mainly located at the superficial fascia, which is covering the femoral triangle. So not only that, we have the cutaneous nerves also. One is lymph nodes, cutaneous lymph nodes, cutaneous arteries, cutaneous veins as well as nerves. So here I will write what are the nerves. Here we have two important nerves which are present at the superficial fascia which is covering the femoral triangle. So first is femoral branch femoral branch of genitofemoral nerve. Femoral branch of genitofemoral nerve. You know that the femoral branch of genitofemoral nerve supplies the skin above the femoral triangle, or in simple words we can say the cutaneous innervation of the skin of the femoral triangle is innervated by the femoral branch of genitofemoral nerve. And another superficial nerve which is seen at the superficial fascia is the ilio-inguinal nerve. You know that ilio-inguinal nerve is a branch of L1 segment of the spinal cord. So these are the contents which are present at the superficial fascia. So we are discussing what are the structures which are forming the roof of the superficial fascia. First we discussed about the skin. Second is the superficial fascia which containing the superficial inguinal lymph nodes, the femoral branch of genitofemoral nerve, the cutaneous arteries, the cutaneous veins along with the great saphenous vein, the branches of ilio-inguinal nerve, and in the great saphenous vein I explained you that mainly the upper part of the great saphenous vein, right? So after the superficial fascia, the third structure is the deep fascia along with cribriform fascia, that is fascia cribrosa. So deep fascia, you know that the deep fascia of the thigh is called as fascia lata. So fascia lata along with the fascia cribrosa. So all these are the structures which are forming the roof of the triangle. So till now we discussed about what are the boundaries of the femoral triangle. After the boundaries we discussed about the structures which are forming the floor of the triangle. Just now we discussed about what are the structures which are forming the roof of the femoral triangle. After this, now we have to discuss about what are the contents of the femoral triangle. So contents of the femoral triangle are very important here. So now here I will write contents. Contents of the femoral triangle. Okay. So in the contents again we will see what are the structures which are present inside the femoral triangle here. Okay. I will draw the inguinal ligament as well as the boundaries of the femoral triangle again for better understanding. So if you see the contents of the femoral triangle contains mainly the femoral artery, femoral vein, femoral nerve. Along with it also contains the deep lymphatics. Not only the deep lymphatics, it also contains some of the branches of the femoral nerve here. Okay. So now let us discuss about the contents of the femoral triangle one by one. So first I will draw femoral artery here. If you see the femoral artery arises from the mid-inguinal point. That is the reason first I mentioned the femoral artery here. It extends from the mid-inguinal point to the apex of the triangle, because the apex of the triangle is directed downwards towards the adductor canal. Okay. So here it extends from the mid-inguinal point to the apex of the triangle, and medial to this femoral artery we have the femoral vein. So here medial to the artery we have the femoral vein. So here the upper 3 to 4 centimeters of the femoral artery as well as femoral vein bounded by the femoral shield. Here you can see the upper 3 to 4 centimeters of the femoral artery as well as femoral vein bounded by the femoral sheath. So till now what are the contents we studied? First one we studied femoral artery. Second one is the femoral vein. And the third one is the femoral sheet, which is enclosing the upper 3 to 4 centimeters of the femoral vessels. Now, more laterally to the femoral vein as well as femoral artery, we have the femoral nerve. So here I will mention you the femoral nerve. So femoral nerve is the most lateral part of the femoral triangle. So here you can see this is the femoral nerve. So this is the fourth content. So it is the femoral nerve. So I will mention here the fourth one is the femoral nerve. So let us discuss about the first one, femoral artery. So not only the femoral artery, in the triangle, the femoral artery gives off 6 branches. 3 are superficial branches and 3 are deep branches. Okay. So in the first one, femoral artery along with its branches. In the branches, 3 are superficial and 3 are deep branches. Okay. What are the superficial branches of the femoral artery? We already studied about this. Superficial, external, pudendal artery. Superficial, external, pudendal artery. The second one is superficial epigastric artery. Superficial external pudendal artery. Superficial epigastric artery. And the third one is superficial circumflex iliac artery. Right? Superficial circumflex iliac artery. These 3 are the superficial branches of the femoral artery which are given off at the femoral triangle. And there are totally 3 deep branches. The deep branches are the first one, deep external pudendal artery. Deep external pudendal artery. So here, after the deep external pudendal artery, we have the largest branch of the femoral artery, which is called as the profunda femoris artery. Okay. So the second one is profunda femoris. Remember, the profunda femoris artery is the largest branch of the femoral artery. And the third one, the deep branches. The third one is muscular branches. Muscular branches. So in the contents, first one is the femoral artery. Femoral artery given off totally 6 branches. 3 are superficial branches and 3 are deep branches. The superficial branches are superficial external pudendal artery, superficial epigastric artery, and the third one is superficial circumflex iliac artery. And the deep branches are the deep external pudendal artery and the profunda femoris artery, which is the largest branch of the femoral artery, and the last one is the muscular branches. Okay. So after this, we need to see the second content, which is the femoral vein. So in the femoral triangle, we can see the femoral vein along with its tributaries. Okay. Femoral vein along with its tributaries. So what are the tributaries of the femoral vein? We studied in our previous topic that the veins follow arteries, right? So the circumflex iliac veins comes and drains into the femoral vein. Not only the circumflex iliac veins, and the superficial veins are also given off, are also drains into the femoral vein. What are the superficial veins? I told you that the veins follow artery, which means the superficial external pudendal vein, the superficial epigastric vein, and also the superficial circumflex iliac vein. These 3 are the superficial veins. All these veins comes and drains into the femoral vein. So what are the tributaries of the femoral vein here? The tributaries are the circumflex iliac veins. Second one is the superficial veins. There are totally 3 superficial veins which accompanies the arteries. And the third important vein which comes and drains into the femoral vein is the great saphenous vein, that is upper part of the great saphenous vein. So the great saphenous vein is a superficial vein. So this superficial vein comes and drains into the femoral vein by piercing the deep fascia, that is fascia cribrosa, which means the opening of the great saphenous vein where it drains into the femoral vein is covered by the fascia cribrosa, right? So the second content we studied in the femoral triangle is the femoral vein along with its tributaries. Now after the femoral vein, now we shall see the femoral sheath. The third content is the femoral sheath. I told you that femoral sheath is a connective tissue sheath which encloses upper 3 to 4 centimeters of the femoral vessels like a sleeve. We shall discuss in detail about the femoral sheath after we finish the contents of the femoral triangle. So the third content is the femoral sheath itself, and the fourth is the nerves. In the nerves, the major nerve is the femoral nerve, right? If you see the femoral nerve, the nerve lies immediately lateral to the femoral artery, which is outside the femoral sheath, which means remember that the femoral sheath is only enclosing upper 3 to 4 centimeters of the femoral vessels, that is including the femoral vein as well as femoral artery, and not the femoral nerve. So femoral nerve is located outside the femoral sheath, lateral to the femoral artery, and this is seen exactly at the groove between the iliacus as well as psoas major, because you know that laterally the two muscles which are forming the floor of the femoral triangle, that is one is the iliacus and one is the psoas major, right? So at the groove between the iliacus as well as psoas major, we can see the femoral nerve. So not only the femoral nerve, we can see another two important nerves in this region. For example, if you see this, the femoral nerve, if you see the femoral nerve above the inguinal ligament, if you see the femoral nerve above the inguinal ligament, it gives off a small branch called as a nerve to pectineus, right? So this is the nerve to pectineus, mainly arises from the femoral nerve just above the inguinal ligament, and it passes behind the femoral sheath and finally supplies the pectineus muscle. So what is the fifth content here? In the fourth content I told you the femoral nerve. The fifth content is the nerve to pectineus. First one is the femoral artery and its branches. Second is the femoral vein and their tributaries. The third one is the femoral sheath, and the fourth one is the femoral nerve, and the fifth one is the nerve to pectineus, and the another nerve which is present at the femoral triangle is the femoral branch of genitofemoral nerve. So the femoral branch of genitofemoral nerve actually occupies the lateral compartment of the femoral sheath. For example, if you see, this is the lateral compartment of the femoral sheath, exactly anterior to the femoral artery, we can see a small branch called as the femoral branch of genitofemoral nerve, which mainly occupies the lateral compartment of the femoral sheath along with the femoral artery. Mainly, I already told you that what is the function of this femoral branch of genitofemoral nerve. Mainly it supplies the skin over the femoral triangle, right? So not only that, another nerve we can see. So what is the sixth content here? The sixth content is the femoral branch of genitofemoral nerve. And next is the seventh content. I am going to explain you. Contents are very important. You need to know each and every content as well as its exact location. Seventh content, another nerve is called as the lateral cutaneous nerve of the thigh. So if you see the lateral cutaneous nerve of the thigh, This lateral cutaneous nerve crosses the lateral angle of the femoral triangle. So you know that this is the medial angle, this is the inferior angle, and this is the lateral angle of the femoral triangle. So the seventh one is the lateral cutaneous nerve of the thigh crosses the lateral angle of the femoral triangle. So by this we finished the boundaries of the femoral triangle along with its contents.